What's up, everybody? I'm Dr. Rossi. I'm a board certified psychiatrist who makes mental health content here on YouTube and various other platforms. And if you're new to the channel, I'm going to ask you to please subscribe to the channel. It helps me to know that this material is helpful to you and it keeps me going and motivated to make more content. With that said, today I'm going to be talking about aphasia. And this has become a really hot topic lately because Bruce Willis recently came out and said he's been diagnosed with aphasia. So what does this mean, and do people really get diagnosed with aphasia, or is there some underlying reason why they develop aphasia? We're going to talk about all that and more in this video. Let's start with a basic definition. You might be asking me first, Dr. Rossi, what is aphasia? I mean, this is like something we don't hear about commonly. I wouldn't say it's like diabetes or hypertension. Not too many people are talking about this. So aphasia is an inability to comprehend or formulate language. And it's usually due to damage to a specific brain region responsible for those processes. In most people, that's going to be the left side of the head, not the right side. Most of our language centers are on the left in majority of people. Now, there are two important points here to note. Two things I want you to take away from this first point. Aphasia is a consequence of another brain disorder. So aphasia usually develops because there's some kind of brain injury. Now, those brain injuries could be things like a stroke, they could be a brain tumor, they could be a traumatic brain injury, like I hit my head really hard in a car accident. They could be the result of a viral infection like herpes simplex virus. So herpes simplex encephalitis could possibly cause this. Or it could be a neurodegenerative process. You can think of things like a dementia or Alzheimer's disease here. The second point I want to make is that there are different types of aphasias. Most notably, they can be kind of broken down into two broad categories that they teach you in medical school and in your psychiatry residency. And they talk about expressive aphasias and receptive aphasias, and I'll break that down for you guys in a minute. So Medical School 101, we're going to go over the two most common examples of aphasia that are taught to every medical student everywhere in the world, I'd say, and are the ones that most people remember from their training. So I said before that we can break it down into receptive aphasia and expressive aphasia. So let's start with the receptive aphasia. So this is called a Wernicke's aphasia, and this is where the person has a fluent aphasia. The person can speak sentences, but there's no meaning behind the sentences. They might use unnecessary words, and they might even possibly create their own words or new words that don't exist in the English language, let's say, for example. They have very poor auditory and reading comprehension, so they can't comprehend what they hear, and they also can't comprehend what they read when they try to read a book or something like that. They have fluent speech, so they're able to talk fluently, but it makes no sense. It's nonsensical. So there's fluent, nonsensical, written, or oral expression. Since they do not comprehend language, well, they often are unaware of their mistakes. So this patient is a patient who's unlikely to know that what they're saying doesn't make sense. It would be, and even if somebody else tells them, they're not going to be able to comprehend it, so they're never going to be able to fully correct it or easily correct it. And we know that this is caused by damage to a very specific area of the brain. This is also known as like the Wernicke's area, and it's located in the left temporal lobe. And we're going to indicate that here with a picture for reference. So let's do expressive aphasia. So expressive aphasia is also known as a Broca's aphasia. And these individuals will speak in short but meaningful phrases with great effort. So you'll be able to see visibly, and also in hearing their language and their speech, you'll be able to see that it takes them great effort to get the words out. It will be noticeable how much effort they're putting into the speech. They are usually able to understand other people, so their comprehension, their auditory comprehension, visual comprehension remains intact, and they're able to understand that they're having difficulty getting the words out. So they're aware of the difficulties that they're having, and this leads to great frustration in many of these patients. Like Wernicke's, Broca's is a very specific location in the brain, so these brain injuries that occur will occur due to damage in the frontal lobe, and that's what ends up causing this presentation. So let's wrap this up by talking about one last example, and that's primary progressive aphasia. So this is actually kind of misrepresented because it's actually a form of dementia. It's characterized by a gradual loss of language functioning, while other cognitive domains remain largely intact, such as personality and memory. It usually starts with sudden word-finding difficulties and progresses to reduced ability to form grammatically correct sentences and impaired comprehension. So there's a few different examples here, and there's more than what I'm going to cover in this video, but I think that's a good starting point for you to understand what is aphasia, what are the common types of aphasia, and to remember those kind of key points that this is usually the result of some other brain injury. There's usually a stroke, a brain tumor, a neurodegenerative process, a viral infection, something that's causing this person to develop aphasia. You don't normally just get diagnosed with aphasia without there being some underlying cause for it. With that said, I'm going to hold the video there. If you guys have questions or comments, please drop them below. I will try to get to them as quickly as possible. And I appreciate you guys watching. If you haven't subscribed to the channel already, please do so. It helps me to know this content is valuable for you.